I was the director of community and patient relations at the hospital. And we did all kinds of projects for patients. Christine Irving was our new intern, and I had a list of projects for her, which came up in our staff meetings or in other places like that. And the first one that Christine glommed right onto was a health resource library.
Well, for me, it was a personal passion. I'd had an experience as a young mother with a child who had a very serious illness, and I was struck with how I didn't have the knowledge, and therefore I didn't feel like I had much power in all of my interactions on his behalf. And then this opportunity came along to develop an idea like that.
Starting it was an incredible challenge. We had not only to find space, we had to lay out the parameters of it first, find space, find money, and actually find people that wanted it to happen that could help us make it happen.
Fortunately, we didn't fit in the hospital. There really wasn't space for us. It forced us to think about going outside, which was, the best thing that could have happened to us. For financial reasons and for broader reasons, we wanted to be sponsored by all the health and medical entities in the immediate area.
I actually dropped my career as a research microbiologist and volunteered for 6 years with the health library. What better focus group, could we have? And really, when I fell into it and joined the passionate founders of the health library, who were all community individuals, and the hospital board helped to create the vision at Stanford Hospital to pilot this concept.
Like everything else that Stanford does, the health library has professionals in their field helping you. So we have information specialists. We have librarians who are trained to find consumer health and medical information. And that's a difference than what you'll find anywhere else. And you won't find that certainly on the free internet. This is, I think, what people come to expect from Stanford Healthcare is this kind of depth, that we have a deep bench, and it's very much what Stanford represents.
In the hospital itself, our primary focus is the patient and the family members. Patients in the hospital aren't able to get to the library, so what we'll actually do is go to their bedside and bring in the materials and do the information interview at the bedside and bring in the materials to them, or the family members.
We wouldn't exist without the support that we've gotten over the years. That actually has been the most exciting thing for me, because that very tangible support has validated every step of the way.
The volunteers at the health library are really special. They're remarkable. We have people who come with remarkable backgrounds who are willing to volunteer their time to help people.
What was great about volunteering was being able to help people who came in who were often confused or afraid.
We started growing out of our space, so our founding donors certainly stepped up. Our board chair, Shirley Madison, and her husband, Duncan Madison, actually committed to help us raise a new and bigger barn at our shopping center. When we built our new cancer center, one of our biggest champions and board supporters, Susan Lioto, and her husband Bernard, actually requested that they be able to donate a health library to be inside our cancer center. And believe me, when a patient gets a diagnosis or gets a treatment plan or is told they're going to have to, have drugs injected into them that have names this long, they head straight to the health library.
The best part about working in the Cancer Center Health Library is the relationships that we're able to develop with patients and family members. They come in during a very difficult time in their lives, and knowing that we are able to connect people to resources that will help them make informed decisions is really an amazing opportunity for us.
The Ravenswood Library is unique in that it serves a trilingual population of African Americans, Hispanics, and a very large Pacific Islander population that includes people that speak Tongan, Samoan, and Fijian. Being able to provide information that meets the literacy needs of those individuals is an incredible opportunity, with a lot of challenges, especially with attempting to find consumer health information in Pacific Island languages.
We are so happy at Stanford Coordinated Care to have the health librarians as part of our team. And actually, we have a team meeting every week, at which the care coordinators present each new patient that come to our clinic that week. And as a team with the physical therapist and the diabetes educator and the dietitian and the physicians and care coordinator and the social worker and the librarian, we all contribute what we can to how we can do a better job taking care of that patient and help that patient towards self-management and assist that patient with choices to be made.
The thing I enjoy doing the most is generally just helping people, helping them find information, helping them in a really difficult time in their lives, and having people come back and say thank you is terrific.
Working globally with the translation and interpreter services that the hospital has, which have been fabulous. With our international medical services, I will use them at times, just to get their expertise since they have that. And also, of course, the navigation team, who are usually the first contact someone might have going through the Corporate Partners program.
One of the really great aspects of the health library that's different than anywhere else is that we're able to offer the community doctors and researchers from Stanford speaking to them in person right here in the library. And then we have them on YouTube, on the Stanford YouTube channel as well, because we videotape them, as well as webcasting them live for the people that can't come, so that there's an immediacy of information coming straight from Stanford right out into the community. And now, when we started 25 years ago, the community was sitting in the room, and that was as far as that information got. But now we're able to take those lectures, which are precious, and take that valuable information and have it in many, many forms available to the public worldwide for free. And that's one of our great, unique resources that we offer from our website, or if you're here in the community, in the library, or at home on your computer. So having that kind of depth that's coming fresh from the research bench right out to the public is just a really wonderful resource.
I tell other clinicians all the time about the Stanford Health Library, and it's a great resource for our patients as well as for the providers in the Stanford system.
What I love about my job is that I'm working at a place where our mission, which is to provide evidence-based information to people to help them make decisions about their health and healthcare, is fully supported by the institution. And not just financially, but in terms of the goal of what we do is the idea that we want to know the patients who are out there, and we want to be able to serve them and connect them and navigate them through a very difficult information journey, to make it easier for them if and when they have to come to the hospital, and just to know a little bit more about what's going on in their lives.
It's a big challenge to be in a university setting and in medicine and dealing with the internet. It will evolve. To me, the fact that it's evolved so successfully over 25 years tells me that it will evolve. It will change as medicine changes, as society changes. Information is power, and it always will be.